Make sure this works. Can you guys hear me? Perfect. Okay, thank you, Dr. Burak, for bringing me here today. I want to thank you guys for showing up, even though it is mandatory. That was a easy joke. Also, I want to congratulate you for being here, because this means not only do you get to hear me, but you also made it into med school, which is hard enough in itself. So congratulations for that accomplishment. Because of doctors that have started from the same place that you're in now, that I'm alive. So I want to thank the hepatologists and the surgeons that have done everything to keep me going. I want to thank you guys for choosing a career that will also help save many lives. I think it's important to get perspective no matter what you're doing. So today I just hope to give you some perspective from my experience going through a liver transplant. So I can't really tell you what it's like. I'll try and go into some detail about how difficult it was emotionally. I'll give you all the symptoms and the timeline and everything after. But basically, it was really, really hard to suffer through this. We were always living in constant fear of the unknown. We actually, we have a 2-year-old son, my wife and I, and it was so scary because I never knew if I would make it to when he was born, to see his first birthday, or even to see him grow up. It was actually the first time I was admitted to hospital with a bout of cholangitis. He was 6 weeks till his due date, and so I cried a lot that night. So I didn't know for sure what was going to happen or how fast I could get more sick and when transplant would come, if it ever came. So that first time that I was in the hospital, the doctors, they saw through an ultrasound, they saw a mass on my liver, which was scary because they thought that it could be cancerous. Luckily, we have really good doctors, really good technology, and I had an MRI a few days later, and it showed that the mass was gone. But we prayed a lot during that time, and it really helped us stay physically and emotionally strong. So I just want to make that point that there is significant data. No, it's not data that I've researched, it's just what the social workers told me, that a patient's hope goes a long way in predicting their success going through a health crisis. So after those difficult times in the hospital, after all the crying we did, I just want to share a quote that reminds me of, I don't know if you guys heard of a motivational speaker. His name's Eric Thomas, and he's a lot more abrasive than I am, but he says, "Don't cry to give up, cry to keep going. You're already in pain, get a reward from it." So for me, my reward was the transplant and another chance at life and spending time with my family. For you guys, school is going to be hard. It's already been hard enough to get into med school. It's going to be really hard going through it. And there's probably going to be times you'll want to cry. But push through it and get your reward. So my wife, can't express the love and gratitude that I have for my wife who went through this. She was my support person. She did absolutely everything for me and our son. She cooked, she cleaned, she took care of us. She had to take care of me with pretty much the same care as her infant son. She would actually, I don't know if you guys learned of pruritus yet, but I was itchy. And she'd scratch my back for probably 3 hours every day. It was, I couldn't function. So it was really hard on her. We were newly married, and I just started getting sick right away. And she had to do absolutely everything. She didn't know if I'd make it or not. There's a lot of fear that comes with it, and I want you guys to know that there needs to be more help and services, not just for the patients, but also their support people and their spouse especially, because there's not a lot out there, and the patient, it goes beyond just the patient in the hospital bed, and the loved ones are all affected too. So now that I've got some of the emotional stuff out of the way, I'll just share the timeline of what happened to me. It was about a 10-year period from initial diagnosis to transplant. In 2005 it started, I got mono, and it may be medically important to note that mono preceded all of my conditions. 2006 I was diagnosed with PSC, primary sclerosing cholangitis. In 2007 I was diagnosed with ulcerative colitis and type 1 diabetes. Once I got those under control, there was about 3 years, 2008 to 2011, that I lived pretty normal, healthy. Then the itch started again, and that was not very fun. I didn't know what was causing it at the time. Nobody really could tell me. I was getting more and more sick, more and more tired. And then in February 2014, we discovered that because of I had active colitis for the last 3 years too. So I was itchy and had active colitis. And then in February 2014, we discovered that I had really low hemoglobin of 70. So I required some iron infusions to get my energy back. But then May of 2014, just a couple months later, they did a liver biopsy. I don't suggest looking at the piece of your organ if they ever do something like that to you, so I passed away. And they discovered that I had moderate inflammation and scarring. So moderate, you know, it doesn't sound that bad, but it's right under severe, so it's not great. For the next 1.5 years, I was in the hospital every month or two for anywhere from a couple days to a week with cholangitis attacks. Kept degrading in health, got worse, got more tired, all my symptoms got worse. Finally put on the list on April 21st, 2016 on the transplant list. And I have a rare blood type, so it only took 3.5 weeks, luckily, and May 16th, 2016, I had my transplant. So I'll kind of tell you how it all happened. So when I was 17, I was in grade 12 and I had a bad case of mono. And I think, again, it is important to note that mono was the start of everything. I don't know if that's medically proven or not, but that's what I had before everything got worse. Now, they definitely call mono the kissing disease for a reason, but my wife is in the crowd, so let's agree that I got it from a water bottle. So, just after being clear of mono, only a few weeks, maybe a couple months, I started having severe pain in my upper right abdomen. And I went to see my doctor, referred me to the GI. The GI got me into an MRI pretty quickly. And it was just through that MRI that he diagnosed me with primary sclerosing cholangitis, or PSC. So that's, I don't know if you guys have learned that yet either, but it's, okay, I'm seeing some nods. But I'll share anyways. It's basically your bile duct is narrowed because of inflammation and scarring. It causes the bile to back up, causes damage to your liver. So I was diagnosed with that, and I was severely itchy right away. I was taking cold styrene powder for a bit, and then the doctor went in with an MRCP, and if you remember exactly what he did, he was only 18 at that time, but what he told me is that he scraped it, so I don't know what exactly he did. He must have cut into the bile duct somehow. Anyways, I felt a lot better. The ick was gone for a few years. Put me on ursodiol, which basically was all he could do, and he said, in about 10 years, you'll probably need a transplant. And he was pretty much bang on with that. So I also want to note that it is important. I got diabetes and ulcerative colitis about a year after being diagnosed with PSC. I think it's something like 80% of people with PSC also have ulcerative colitis. So that's something to keep in mind. So my symptoms, I have them all written out here, but I think you've been learning about them all. So I suffered from pruritus. It was really bad. Like I said, my wife would scratch my back 3 hours a day. I would wake up and the sheets were bloody because I just, in my sleep, I would scratch. It was terrible. It was actually in this building that I met my hepatologist, Dr. Eckstein. You might meet him in the future. And I was itching so bad, but medically I wasn't anywhere near ill enough to get on the transplant list. And I asked him, when can I get on the list? Like, I need a transplant now. And he just looked at me and he said, "You're my best Dr. Eckstein accent." He said, "Well, I'd rather have you a little itchy than 6 feet under." Yeah, he had a good sense of humor. He was never shy to tell me like it was, but he always put a funny twist to it. He also gave me percentages on the odds of survival. So that was fun. So you're all very smart, but I would also recommend a level of humor with your patients where it's appropriate. It makes things a lot easier. I suffered from jaundice, portal hypertension, so the pressure from my liver hardening just caused the blood from my portal vein to seep other vessels, which caused stomach varices for me. And those didn't get too bad for me, but they are always in danger of rupturing. And I think it's about half the people that suffer from this, they do rupture, and that sends them to the ER. It's internal bleeding, it can be very serious. Encephalopathy, that one was fun. So that caused a lot of confusion. For me, it can get really extreme for lots of people. For me, it destroyed my sleeping patterns. I couldn't sleep at night, I'd nap kind of throughout the day. Nothing was normal. And now, after transplant, talking to my wife, we realized that I actually don't remember a lot of things that happened before the transplant. So it was worse than I thought it was. And extreme fatigue, that was also difficult. So I'm just summing it up by saying, think of the most tired you've ever been, and then kind of be like that for about 2 years. That's how I felt. So I'll try and remember everything that happened for my transplant. Luckily I wrote some things down, but a lot happens during your transplant. So anything that comes to mind, you can just ask me after. We're going to have some Q&A after this. So it was May 15th, a Sunday. We're actually having a garage sale. And I got a phone call. And they said, do you want to come to Edmonton? No. First, come to Edmonton. I guess they do have to ask, but yes, I'm going to go to Edmonton. They said, you're a backup to the primary recipient for a liver transplant. Will you come? So immediately, well, I put the phone down for a minute, and I was like, yeah! The second any emotion hits, I just got excessively itchy. I scratched for about 5 minutes, and I told her, yes, I'm coming. Fully expected. By the time I got to Red Deer, I thought she'd call back and be like, oh, it fits. They thought that it wouldn't fit into the primary recipient, and so I thought I'd be turned around. But call, made it to Edmonton. Right when we got into Edmonton, they said, it doesn't fit. It's your liver, so get to the hospital. Okay, so it's real, it's happening. I can't really describe the emotions. It was just a surreal feeling, right? So we were in Edmonton, already there, and they said, get to the hospital. So I was like, okay, well, we're going to the hotel across the street. Got my wife, my mother-in-law, and my son there, unloaded their stuff, prepared to stay for the long haul, and then we started walking across the street to the emergency room. And most patients don't walk across the street to go for their liver transplant. They called me and said surgery's in 2 hours, get here now. So I was just coming into the building, went upstairs, and it was just a whirlwind of activity. I went in, there was a nurse waiting for me, he got me into a bed, started IVs, they took lots of different blood samples, I had lots of people coming in, coordinator, surgical fellow, they're asking questions, signing waivers. I had to have a woman came in and shaved me. So that was awkward right in front of my wife. They put me in a shower, gave me a special soap to get me as clean as possible. Then once I got everything organized, ready to go, I waited. Thought it was supposed to be at 6. 6 o'clock rolled around, nothing happened. 6:30, someone came in and said it's been delayed. So that was fine. I just sat there on the bed with my wife for the next couple hours. And it was somewhere between 8 and 8:30 they came in and got me. And I'm so nervous to go for a transplant. I think about how nervous I'd be to come and speak to you guys, but the transplant's a little more nerve-wracking. So I'm outside of the operating room, and the anesthetist comes up to me, and he's talking to me, and all I say, I'm like, I need something to calm down first. So he waits, unfortunately, until I get in the operating room, and I see all the equipment and everything, and then he gives me something to calm down. And the doctors are introducing themselves to me, and I'm starting to drift off, and I don't remember much of that. So after being in the ICU, I don't actually remember how long I was in there. It felt like only a day or two, but apparently it was longer. After that, they're all done, I guess. After that, I went into my own private room, where the goal is to get you feeling better and be a little more independent, do things on your own. And my stomach started getting bigger and started hurting, so I was developing ascites, and the fluid was building up and it was infected. And I felt that was probably that, and then the actual paracentesis. It was the worst pain that I've actually ever been in. So they ended up draining 4 liters of fluid from me, and I had a resident doing my paracentesis. It didn't go very well. Oh, man. He poked, I thought it was in, he was pushing, you could see the ultrasound, it was pushing on the wall. He was pushing on that, and then finally I saw it go. Oh, that hurts so bad. And then he says, it didn't actually go through. I have to do that again. Oh, okay. So I felt that twice. So that's fun. Anyways, it eventually drained, had the bag with me for a couple days. Eventually drained everything and it stopped coming back. After that, things really died down. I was recovering well. My blood numbers were good. I dropped 20 pounds from my original weight going in. And then after 16 days in the hospital, went across the street and spent the next 10 days at the hotel. But every day came back for physio and blood work. And then day 26, finally went back to Calgary. And been recovering since. Now it's only been 3.5 months since my surgery. And I'm doing fantastic. All my blood numbers are good. I'm exercising again. My incisions healed up really nice. But I did go in on a MELD score. I think it was like a 14, which just cuts it to get on. And most people somewhere in their 20s before they get their transplant. Most people don't go in as relatively as healthy as I was. And the healthier you can go in, the better you can do in recovery. So that's why it's important, if you haven't already, be an organ donor and share that with your family and friends, because the sooner anyone can get an organ, the better they do, the better their odds are. Now all I have to do is take medicine every day. Right now it's twice a day. Hopefully we'll get it down to 1 a day in a while. I'm not worried about that. I'm alive, I'm healthy, things are good. I have to get my blood checked regularly. I can't eat grapefruit because that somehow stops the anti-rejection medication from working. Stay away from anyone who's sick because I have a much lower immunity and I can contract anything really easily. And also because of that, I have to avoid the sun because skin cancer happens a lot easier for transplant patients as well. That pretty much sums up everything that I had. We can do some Q&A. I'm going to have a seat for that though. If you guys have any questions, let me know. Thanks.
No swelling in the legs?
Nothing swelled until after the transplant because it was in my legs. I forget what they call it, China's facilities? There was
Yeah.
There was like, I don't know what it is, something new for the too.
Yeah, so that's the fats. So that's why, ascites is one of the bigger complications we're going to learn about this week, and we'll talk about it on Friday. But it's one of the major complications that we transplant people for is having ascites beforehand. Post-operatively, you can get interruption of the lymphatics, and the lymphatics is where your fat tracks up to your thoracic duct, and so sometimes with operation, you can develop ascites. Okay, I'm going to open it up to you guys. So questions? In the back.
Thank you for sharing your story. I'm just wondering, you mentioned you got your diagnosis of PSC around 17 or 18.
Yes.
And then we're told at that time that you would probably get transplant in about 10 years.
Yes.
I'm just wondering, at that age, getting that news and getting that diagnosis, did that change your plan as a young adult or limit the activities that you participated in at all?
I would say so. My plans were a little vague at the time. But I was going to go into arts and science, and then I started kinesiology, so I started my plan the way I thought I would. So it didn't really interrupt that at all. It was just the idea that one day things are going to change. But I do have a friend who had a kidney transplant when he was 14, so he was a good person initially to talk to, because he was like, oh, don't worry about it. 10 years later, he's like, look at me, I'm 10 years, whatever, I'm fine, everything's fine. So it didn't really alter anything for me, except that it was always in the back of my mind now that one day it's going to happen.
Go ahead.
I'm just wondering how fast after the transplant things started to clear up, so your arthritis and your...
Oh yeah, I mentioned that. So my eyes looked a bit better, like immediately. They were clear and there wasn't dark bags under them anymore. I actually, the first day I was sitting there and I started scratching my arm. And I just looked down and I was like, I'm not itchy. I was actually scratching it down. So immediately things were getting a lot better. I felt, the painkillers helped, but those two main symptoms were really noticeable right away. My skin was a lot better. So it was, I'd say, instant.
Yeah, it's remarkable how fast that turns around. When I when I did my transplant elective in Edmonton as a GI fellow 17 years ago, I remember we brought somebody in for transplant. And it's uncommon just to have to transplant for pruritus, but sometimes it's such a troubling symptom that we will put people on the wait list earlier than we normally would. And Tyler mentioned the MELD score, and you know, that's kind of how we rank patients. Who's going to be the sickest, has the highest chance of dying, and we have a sickest first policy, so we try and give the organ to the person who's next most likely to die on the wait list. But once in a while, we will put somebody on for quality of life issues like pruritus, and I remember we transplanted somebody while I was up in Edmonton for that month, and she was brought in for primarily just for itching, and I saw her in the recovery room, and that was the first thing she said, it's gone. That's awesome. It's gone. I can't believe it. And she went home after 6 days. Like she went in really well other than itching. And unfortunately, it's really tough to do that now because we have so many people in need of liver transplant, and we have such long waiting lists. And unfortunately, we have about 20% of people that don't make it to a liver transplant. We have that kind of mortality in the waiting list. So, did they talk to you about live donation?
Yes.
I guess, you know, being in the AD group with the wait time being shorter, it's less important, but for some patients, that's their only option, is having a live donor liver transplant.
And we were campaigning for a lot of livers. Again, I only was on the list for 3.5 weeks. So. But also with AD positive, my blood type,
Right.
it is possible that if I needed to, I don't know if it's really if you need to or if I can just do it, but I can accept any type of liver. So there's an extra benefit to my blood type.
Yeah.
Thank you very much for sharing your story. I was just wondering, just maybe a question for you, Tyler, or a general question. Do antihistamines and the other medications for itching, do they really help at all, or it seems like not all that much?
Yes. So what I used was pulsatazine powder. It helped a lot initially. It didn't help as much as things got worse. But what they did start me on, that was really my only option. There wasn't the
Did you take Rifaximin?
yeah, it just started that. I only took it for like a week, so then my transplant came. So I don't know how it works.
So we start with the sedating antihistamines, like not the Claritins, you know, the one that guy drives around in the van, that's so happy. But the old style ones, the ones that make you groggy. So we give them primarily at night because they will knock people out. And you know, Tyler was talking about this encephalopathy, and that can be a real problem if you're making people that are already confused or sleepy and have this, you know. So even sometimes antihistamines can precipitate worse than confusion or grogginess because they hang around so long. So we use them primarily at bedtime, and we use the cholestyramine powder once, twice, sometimes 3 times a day. 3 times a day, yeah. And it's not fun. It's a slurry. Yeah, tell them how it tastes.
Well, they come up with some new flavors.
Yes, I see.
It's like
I've seen that. But yeah, so it's this powder, and you have to drink it in juice and take it 2 or 3 times a day. And then the next lines are rifampin, which is an antibiotic. It's a tuberculosis medication, but it revs up the P450 system in the drug metabolizing system in the liver. And so whatever it is, and we don't know what the actual thing that makes people itchy, it gets metabolized more by taking this antibiotic.
good thing you have a doctor up here telling me things.
And that, yeah.
I was just wondering if your transplant has impacted your colitis or diabetes.
Yeah, for the positive. My diabetes is a lot easier to control now. Now that I'm sleeping through the night too, that everything's kind of in line. I'm eating better too because, well, going through the transplant, you know, I used food as a crutch when I wasn't feeling good or anything, and I just wanted to eat. I know lots of people lose their appetite, but I never lost mine. Maybe for a bit closer to the end, but yeah, the diabetes is a lot better to control. My liver is functioning properly, so that helps. And colitis, I haven't had a flare up since I moved to Alberta. Actually, it's Dr. Green, who's my guy. So
transplant some people with diabetes, and the diabetes can get better. But we take a lot of people that weren't diabetic, and there's this really interesting association. Our number one indication of a transplant is hepatitis C, and hepatitis C post-transplants, you're more likely to get diabetes. And you throw tacrolimus in there, and about 25% of our patients become diabetic after transplant. So it's a really big problem with the drugs. You mentioned the skin cancer risk, but a lot of the other side effects in the long term that we deal with from the drugs are diabetes and gaining weight and obesity and high lipids, and all these things put you at risk for having heart disease and things. And the colitis thing is interesting. About a third of people, their colitis will get better. You'd think, we treat colitis by suppressing the immune system, right? So it should get better. A third of the time it does, a third of the time it stays the same, a third of the time it gets worse. So it's kind of all over the place.
And actually, I should mention, there was talk of the possibility of doing a double transplant of the pancreas with my liver at the same time.
I remember that discussion.
I don't know what happened, what didn't happen.
I think the donor, it wasn't, there was an issue with the donor's pancreas, so as I recall. Yeah, I mean, that would have been ideal, because I would have, or even transplanting islet cells at the same time, could have potentially got Tyler off of insulin.
Yes.
I was wondering about, you mentioned that you were on versatile, your primary exposure to cholesterol.
Yes.
I think we even thought that we actually don't use that for PSC more. Did you notice that it helps at all?
No.
And is that no?
Over the 10 years, I just watched my enzymes get higher and higher and higher. And Dr. X even told me that when I first started seeing him, he's like, there's not much indication showing that it does anything for you. But we just kept me on the dose that I was on for the last 8 years anyways. But yeah, I couldn't.
So that's an interesting story. I talk about it a little bit in the podcast, but very briefly. It's a drug that we were using for PBC, which clearly works in PBC. It makes people with PBC live longer, lead less from varices, lowers the liver enzymes. So they started studying it in PSC at the same doses, and it lowered the alkaline phosphatase in PSC, but it didn't really seem to impact the need for transplant. As Tyler said, 10 years, half the people will require transplant, 8 to 10 years. So they said, well, it didn't work, so why don't we double the dose? And so we did a big randomized control trial on the higher dose, and I remember going down to this was before Dr. Eckstein came to Calgary and started seeing all the PSC patients, but I remember flying down there and they were presenting the results of this meeting. I was reading the abstract and I was like, oh my God, I have all these people to call when I get home, because not only did the high dose urso improve the alkaline phosphatase, but more people required liver transplant. More people died of complications of cirrhosis on high dose urso. So we had to take all these people off urso when the results of that study were published. So to date, still, PSC is a disease without a treatment. So.
I'm wondering if your diabetes, did that have a significant impact on your liver disease before or during or after the transplant? Did that make things harder?
I couldn't tell you because I got the liver disease was diagnosed first, so I couldn't tell you beforehand. But after transplant, it was hard to readjust my insulin requirements. I was running really high for the first few days after the surgery. I wouldn't say it was too big of an impact. Just initially after the transplant, it was noticeable that I needed to make some changes to fix things.
You mentioned you got the data in house during this ordeal. Did anyone further the problems with the healthcare system provide any financial compensation for that during the time?
For that specifically, no. So we are on AISH, which is Assured Income for Severely Handicapped, and there are all sorts of, I guess, extra money that you can get, and there is some for accommodation, but if you have more assets than $3,000, they won't help you out beyond your income. So we got our help from church, from friends, from family. Basically, that's where we needed that, otherwise we'd be pretty in debt right now.
It's a big part of the, we teach you guys a lot about the medical aspects of disease, right? And dealing with the medical, learning how to diagnose liver conditions, how to deal with the complications and stuff. The transplant clinic is a real multidisciplinary team. We have a social worker there that addresses those financial issues and tries to make sure that patients have appropriate coverage for drugs and the additional cost. These people in the front row here are probably the most important people involved in the transplant process, which is the family and the support for them. And yeah, it's a big thing when we're assessing people for transplant, is to make sure that the social aspects of everything are in place, that they have the social support, that they have the financial means to go through that, because the transplants in Alberta are all done in Edmonton. In fact, all the children for Western Canada, including all of British Columbia, Saskatchewan, Manitoba, are done in Edmonton, and a lot of the adults from Saskatchewan, east part of British Columbia, all of Alberta, are done up in Edmonton. So a lot of people have to relocate for a large, sometimes several weeks. In the back.
So I was just gonna ask about, I guess your thoughts on the mono theory about how that maybe could take off. I know in the podcast you mentioned that there's kind of like there's like that Venn diagram, I guess, of like, you know, a specific host environment and then some other sort of maybe triggered, whether or not you thought mono would have been that triggered. Had it not been mono, you're 17 or 18, if it would have been something else 2, 3, 4, 5 years down the road.
Yeah, that's good.
I don't know anything medically about why it might be related. I just know that there are other people in our lives that have had mono and then gotten severe medical issues.
You mentioned they did a liver biopsy. Did they say you had any overlap with autoimmune hepatitis? Or?
Yes, they did.
Yeah.
I was on here for that part of it.
So there's a definite association with viral triggers in autoimmune hepatitis, and as I taught you in the podcast, autoimmune diseases travel together, so you can see that, right? So yeah, autoimmune hepatitis, PSC, diabetes, you know, all of these immune conditions travel together, and a lot of the times there's a trigger in the environment. Sometimes that's an antigen, an environmental antigen. We don't know what it is, but clearly there's an association with triggering autoimmune hepatitis with some viruses, including hepatitis C can trigger autoimmune hepatitis. So yeah, that's an interesting thing. Mono in itself can cause, you know, a big liver and jaundice and hepatosplenomegaly, and you probably had all that large spleen when you had it. Yeah. But it's, yeah, then in somebody that's genetically predisposed, that can trigger an ongoing autoimmune inflammatory process in maybe different organs. So.
Up there.
So on the topic of autoimmune conditions, like kind of travel facts, but also, did you happen to have any family history of other autoimmune disorders?
So let's see how this works. I have 2 great uncles who have Crohn's. I'm not extremely closely related, and I have it would technically be my mom's cousin that has Crohn's, but other than that, there's no type 1 diabetes, there's no other liver issues, there's nothing.
But you know, it's a stronger association if it's a first-degree relative, but obviously there's a genetic predisposition traveling through the family and that's very common in inflammatory bowel disease. Go over here and then we'll come back to this.
I'm just curious about how much kind of self-education or self-teaching you have to do in education as well as issues of managing multiple medical issues that one with diabetes can be quite extensive in the process of getting started.
Right. Diabetes, I basically did it on my own. When I was diagnosed, they gave me my insulin pens. I would once things got a little more extreme, when we started looking at what's called the CA19 number. Once we started talking about that, I stopped researching, because that was talking about possible cancer and things like that. So then I totally stopped worrying about it and let the doctors just don't worry at that point. There was a time, so I had that 3 years of active colitis. Had colitis as a remission for 3 years, and then 3 years it was active. After that 3 years, so what's happening the whole time is I was on prednisone for, whatever, it's a 4-week course, and then switched to Mezavant or Salopol, what you call it ones. 5-ASA. So sorry. I just switched back and forth, and then I read that Salopol takes 36 days to be fully into your system. And so I told the doctor that, why don't I just go on prednisone but keep taking Salopol? So I did that, and I haven't had an issue since. I feel like my research helped in that scenario. Who knows if it was just a fluke or not.
I'm wondering, do you have any side effects from your egg rejection meds that you take daily?
A little bit. It was worse, so it fluctuates a lot in the first little while. I was anywhere from 1 milligram twice a day of tacrolimus. I got up to 5 milligrams twice a day. When I was at 5 milligrams, my hands would pretty much be doing this. See, like a very visible tremor. Right now I'm doing 3.5 milligrams twice a day. So it's a little less, but it's still shaky. So,
Any headache?
no headaches. Things I can share. Sleeping is good now. When I was on a higher dose, I did have trouble falling asleep.
So you're sleeping all the time.
I'll just share it. The general problem that people have with CellCept is diarrhea. And I haven't had it nearly what bad as what they're warning me. So I don't find that it's not that bad. But I also wanted to point out that I don't want to hear anyone complain about constipation. Because when I was in the hospital after that surgery, it took me like almost 2 weeks to make a movement. That was terrible.
You were liking those pain pills.
I guess, yeah, that's what I said.
But
They run it around.
yeah, I know, but it's really important, obviously, to get analgesia after a major surgery. But as you guys have learned, right, narcotics slow down the bowel, and that's made, post-op IBS and constipation to be a major problem. Are you still on prednisone or no?
No, I didn't even take that.
After the transplant? So,
Awesome.
yeah.
So hard on the diabetes too.
Different transplant programs will do it slightly differently, but most programs now are getting away from using steroids because they have so many side effects. The one patient population sometimes where we will use prednisone long-term is if there's autoimmune hepatitis, because as you know, it's a treatment for autoimmune hepatitis as well. The tacrolimus has a lot of neurotoxicity, so it causes the tremor and headaches, and the long-term thing that we worry most about with the tacrolimus is the kidneys, because it causes the blood supply to the kidneys to squeeze, and unfortunately about 5% of our liver transplant patients, 5 to 10% end up on dialysis, and some end up needing a kidney transplant in the long run. So we're very careful that Tyler mentioned he has blood tests all the time. We're constantly checking the levels. If the levels are running too high, you get shaky, but you also get long-term kidney damage. So we try and keep the levels as low as possible, trying to prevent rejection, right? So it's this happy medium between having rejection and having the side effects.
And there's no set.
Everybody's an individual, and there's no one way to do this. We have a long list of drugs that we can use. They all have their own side effects. So if we're having major problems with side effects, we'll switch to a different medication and try and find a combination that works. He mentioned CellCept he's on. He's got colitis. I tend not to like using CellCept with colitis because it can precipitate colitis itself. We've had people get, a Crohn's colitis like picture just from the drugs. You stop it and it gets better. So azathioprine, which he was using for your autoimmune hepatitis, right? Beforehand is another option that we could use. CellCept's a little bit more MMF, it's a little bit more potent, but we could switch to that if we have to. So there, there's things to play with depending on.
And what would you say
Constipation. They, how do you tell them how they rerouted your
Okay, so
yeah.
I don't know exactly what they did, but so they wanted to get rid of my old bile duct entirely. So they cut all that out and somehow, I don't know the exact anatomy, but they connected, they took a portion or rerouted my small intestine and connected that up to the liver to where it passes the bile duct. Is that right?
Yep.
I don't know the term for it, but that's what they did.
It's after a French surgeon, so it's a grew on the Y. So the Y is the,
Sounds sexy.
yeah. So, yeah, basically they took a little of your small intestine and sewed it up to the liver, right? Because those bile ducts were all diseased and they were causing problems. And Tyler mentioned the one big concern that he had beforehand was getting cancer of the liver. And the risk that PSC patients have is getting cholangiocarcinoma, which is a cancer of the bile ducts. It happens in about 10% of people, and if it happens, outside of the liver, there's an experimental protocol that's done at the Mayo Clinic and now down in Toronto and Montreal to transplant people like that. But if it happens inside, if he had a liver mass, that would have been cholangiocarcinoma, he wouldn't have got a transplant because the risk of the tumor coming back is too high. So that risk of the bile duct cancer is a big thing. So we can't leave behind diseased bile ducts afterwards. Put a new liver, sew it onto a diseased bile duct would not be a good thing because it's all going to be narrowed and so the whole bile ducts have to be removed and a new bile has to be taken up to the liver. We do that as well with live donor liver transplant and sometimes with pediatric liver transplant. All right.
It sounds like self-advocacy was actually a big part of kind of your experience, and I was wondering how much you felt like you were kind of observing yourself over your kind of course, looking for worrying signs and kind of coming in like as a query, or if you felt like there were adequate check-ins to just kind of ride the course.
We were watching all the time for signs. I was checking my temperature every day, even if I felt fine, just because any fever could indicate an infection coming. So I'd be getting bouts of cholangitis is what put me in the hospital. And so I always check my fever. We're always looking at my eyes. It's very yellow in them. Mostly it's my wife doing the checking. Because even if I was starting to feel feverish, I didn't want to go to the hospital because I knew that'd be at least a few days when I'm not at home, right? But she forced me to go. So yeah, I'm always, every day I was definitely checking my temperature and checking for any yellowness.
Are you on rotating antibiotic?
Yes.
Yeah.
3 different antibiotics.
So cholangitis, bile ducts get scarred up so the bile can't drain. Bacteria is constantly coming from our gut, going up through our portal circulation to our liver, and the liver deals with that by flushing it back down the bile ducts into the intestine. But if the bile duct's all scarred up, the infection starts to grow in the liver, and you get an ascending cholangitis. So if that happens over and over again, that's an indication for transplant. And we try and deal with that by actually suppressing the bacterial counts in the liver by just rotating antibiotics. And we rotate antibiotics because you don't organisms, so you switch to another one hoping that they'll have resistant organisms and then back and forth. So. Oh wait, it's 12:30. I know we started a little bit late, but why the grapefruit juice? Yeah. I want to know if you understand the last step.
I don't know the physiology, but I just know that it'll stop the anti-rejection drug.
Anyone come across that?
It impacts your CYP450
Right.
enzyme system, so it works better than it should, so it metabolizes stuff too fast.
Yeah, so the cytochrome P450 system, which is in the liver, the drug metabolizing enzymes. So it's really important. We tell our transplant patients, anytime the family doctor is going to start you on an antibiotic, check in with the transplant clinic, make sure it's okay. Because if there's a significant drug-drug interaction, like an antibiotic like clarithromycin, for example, you give that to somebody it's also metabolized through CYP3A4. Your tacrolimus levels could go sky high, and you could not only get tremors, but your kidneys could shut down. So we really worry about drug-drug interactions. Those enzymes are also in the brush border of the gut. Okay, grapefruit juice doesn't get metabolized in the liver, but in the gut there's some CYP3A4 in the brush border of the end so there's actually drug metabolism that happens in your gut. So if you're taking grapefruit juice, it can start to be metabolized by that CYP3A4 in the gut, and so more of your tacrolimus is going to get through the gut then because of the competitive, it's not metabolizing the tacrolimus, it's not metabolizing the grapefruit juice. More of it will get into your system and your levels could get high and you can get toxicity. So we always tell people to avoid grapefruit juice, and that's the lesson that we'll end on. All right. Yeah, so come up and ask Tyler if you have any questions. If my clinical core group can just come up and see me, we'll get our calendars synced up for doing some clinical core sessions. And on Friday, we're going to go over